The CO2 laser fell a little bit out of popularity because of some of the side effects. It left a white line of demarcation. We couldn't use it on the neck and chest. A lot of people didn't want 12 weeks of red downtime and oozy skin. And some patients had what we call ectropion, where the lower eyelid was pulled down. And that would take corrective surgery to fix. Although these were rare side effects, they weren't side effects that as a physician I was willing to accept for my patients. Then we went all the way the other extreme and we did what's called a non-ablative procedure or a non-ablative Fraxel, when we did a procedure where we just tightened the skin and we improved the top layer of the skin, which is what we call the epidermis. So there wasn't any downtime, a little bit of redness, a little bit of swelling, but very, very minimal. But we didn't get the results that we got with the CO2 laser. About a year ago, the CO2 Fraxel hit the market. And what we love about this machine is that we get almost what we got with the old-fashioned CO2 laser, but not with the side effects. So it really has been a home run for us. So we maybe will get 70 to 80% improvement. We can get some tightening of the skin. We can get rid of a lot of the red. We can get rid of the brown spots. We can get rid of some of the lines on the neck, the brown on the chest. So it's a laser that we do. It takes 2 to 3 hours in the office. It's an uncomfortable laser. The patient is a little bit uncomfortable. We give them as many drugs as we possibly can. And then they're not red for 12 weeks. They're red for about 2 to 3 weeks. And within 72 hours or 3 to 4 days, they can wear makeup.
Well, I think the devastating thing for me was the instant aging, instant menopause, instant the grayness, the aging, and the dry skin, and all of those things. When it's gradual, you don't see it, but when it happens instantly like that, it is a dramatic change to deal with. My new message is that cancer scars you, and once you survive it, you don't have to deal with the scars. There's ways to reverse it, and I'm anxious to see how much of it we can reverse. Everybody says so. Oh, Linda, you look so great. Oh, your makeover is great. And I keep saying, but it's not over yet. Just wait. I am scared to death, but I'm excited, yes. Let's get going. I'm ready.
With Linda, I'm hoping to improve on the texture of her skin. She has old-looking skin, and what she's been through, the chemotherapy, the emotional and the physical stress, it put her and it threw her into an early menopause, and her skin just doesn't look the way she or I would like it to look. So we hope to soften the skin, give it a better appearance, get rid of some of the red in her skin, get rid of some of the brown. We hope to tighten it up. We hope to shrink her pores up. And if we can get even 60 to 70% improvement, I would be thrilled. Fraxel to a cosmetic dermatologist and to the patient and the public is something that can reverse time, take that time clock back 5 to 10 years with less expense than the older procedures that we had, and very minimal downtime and safety, which is what we're all about. We'll probably see results in 2 weeks. The results will be dramatic in 30 days. And you continue to get results for 3 to 6 months. She will be oozy, bloody, red, not presentable for 3 days. It's the price we pay for beauty.
I think all the things they gave me to relax me, I'm starting to, unwind a little and relax, so that's nice. I was a little nervous.
There you go. You okay?
Yep.
Your eyes aren't stinging or burning, are they?
No.
Okay.
I'm numb.
That's what I like to hear.
My mouth moving. I don't think I can make the letters very well.
I won't do anything without warning you, okay?
Okie doke.
How bad is that?
On a scale of 1 to 5,
Yeah.
4.
Okay. Unfortunately, you can't numb up the eyelids.
Right.
We can quit the eyelids. We don't have to do them.
No, we're going to do those. That's the part I hate the most.
I can't put any numbing on her
Okay,
eyelids
hon.
at all.
It's all right. We're good to go.
And I don't want to put her to sleep.
No. No.
Some people do, but I think that has more risk associated.
Yeah, that was not fun.
I'm sorry.
No, it's okay though. I'm all right.
Break. Break.
Okay.
You're doing fantastic. I'm marking it so I know where I've been. because when I come back in a minute with another pass, I don't want to go over where I've gone. You know, it's uncomfortable, but you shouldn't be in pain.
Okay.
One thing is uncomfortable and one thing is pain.
Okay, yeah.
What it's doing is making little holes in the skin all the way down and sucking some of the skin out. I think in general things went fairly well. She's a fabulous patient. She's very, very positive. The only thing that we had trouble with was getting the amount of pain control that we would have liked to have gotten. For example, in most patients that we do, some of them relax, some of them snooze, some fall asleep through the procedure. She didn't fall asleep. She had a considerable amount of pain in the beginning, which forced me to turn the settings of the lasers down more than I would have liked to. I think she's still going to get an excellent result. I think we're all going to be happy, especially Linda, with the results. But we had a little trouble with the pain. All in all, she did phenomenal. We'll just have to wait and see what happens with her results. I feel confident that from beginning to finish with this makeover, she's going to take at least 5 years off. We're hoping for the 10 years. I think her results are going to be very, very, very good. But I've got to be honest with you, we had a little bit of trouble with the pain control. But every patient is different, and we always do our best, and we take our time, we never rush, and we let the patient guide us. By day 5 to 7, she'll be fantastic. On day 3 or 4, she'll have makeup on. In 30 days, we want to meet with you again, take some more pictures, and I think you'll see that compared to when we started this process, she's going to look fabulous.